And you mentioned a little bit of the difference between a psychiatrist and then say a clinical psychologist. Could you maybe expand on that just a little bit? Because I think it more so probably in the general population, people may, often, as often confuse those two things. And they're, the training is very different. And I imagine what, the intricacies of what each field does are somewhat different.
They are different. And there also can be some significant overlay. So psychiatrists go to medical school and psychologists get their PhD in essentially psychology. So we are more medically trained and probably have a little bit more of a medical model of looking at things, a little more focused on, are there any other potential physiologic problems or underlying medical conditions that are causing the symptoms, and can prescribe medications. Now, there are states where psychologists can prescribe psychotropic medication. Ohio's not one of them. Psychologists are going to do more psychotherapy. They'll do more psychological testing. So when you think about the Rorschach, the Inkblot test, or memory testing, so like in-depth neuropsychological testing, because we're looking to see either where somebody might have a specific learning issue or a learning disability, or people who might be starting to show signs of dementia, and we're trying to better understand where their deficits are. The psychologists are going to do a lot more of the testing and a lot more psychotherapy. We can, as psychiatrists, do as much psychotherapy as you want. We're trained in psychotherapy and can do it. The reality oftentimes is that there's such a need for psychiatrists and a need for people to prescribe medication that I think most psychiatrists probably don't do as much psychotherapy as they do medication management on the outpatient side. And the psychiatrists obviously are the ones who are going to have the admitting privileges in the hospitals because we're physicians. We're going to run the inpatient units, see the inpatients.